Glaucoma. It is a group of disease characterized by progressive form of optic nerve damage, generally but not necessarily associated with raised more than 21 mm Hg intraocular tension, but etiology unknown. It has two principal clinical forms: open angle glaucoma and angle closure glaucoma. Now we read about open angle glaucoma, which is also called wide angle, chronic and simple glaucoma. Probably genetically predisposed degenerative disease affecting patency of trabecular meshwork, which is gradually lost past middle age. And what is this trabecular meshwork? It is a spongy tissue located near the cornea through which aqueous humor flow out through the eye. In this open angle glaucoma, intraocular tension increase and the ocular hypotensive drug are used on long-term basis to treat open angle glaucoma. Now we read about the ocular hypotensive action of this topical drug, which included 5 categories of the drug: beta adrenergic blockers, alpha adrenergic agonists, prostaglandin analog, carbonic anhydrase inhibitors, and fifth one is myotics. Now beta adrenergic blocker example like timolol, betexolol, levobinolol, cartilol. First line drug till recently, but prostaglandin F2 alpha analog preferred drug now. Action by lowering intraocular tension by decreasing aqueous formation. Now, ocular side effect of this beta blocker: generally mild and infrequent stinging, redness, dryness of eye, corneal hypoesthesia, and blurred vision. Systemic adverse effect of these beta blockers are major limitation in use of these blockers due to absorption to nasolacrimal duct. Life-threatening bronchospasm has been reported in asthmatic and COPD patient. Bradycardia, occultation of heart block, CHF likely to occur. It is minimized by applying mild pressure on inner canthus of 5 for 5 minutes after instilling eye drop to prevent entry of drug in nasolacrimal duct. Timolol. Non-selective beta blocker, no local anesthetic or intrinsic sympathomimetic activity, 25 to 30% ocular tension fall within 1 hour and last for 12 hours. Levobinolol, it is introduced as a once daily alternative to timolol. Betexolol. It is offering advantage of less bronchopulmonary and probably less cardiac, central and metabolic side effects, but less efficacious than timolol in decreasing intraocular tension. Angle closure glaucoma occurs in individuals with narrow iridocorneal angle and shallow anterior chamber. Intraocular tension remains normal until an attack is precipitated, usually by mydriasis. Intraocular tension increase 40 to 60 mm Hg, emergent condition, marked congestion of eyes and severe headache. Several measures to decrease intraocular tension: hypertonic mannitol, acetazolamide, myotic, topical beta blocker, apraclonidine, latanoprost. Instillation may be added. Drug used only to terminate attack of angle closure glaucoma.